ICD-10, Technology and Communication. ICD-1 was originally created in 1979 by the World Health Organization and then passed on to industrialized countries throughout the world. The U.S., however, is one of the last industrialized countries to adapt this code, which was adapted in October 1st, 2015. ICD-10, which is the 10th revision of ICD-1, is a worldwide communication code needed to activate billing systems everywhere. A committee was formed called the ICD-10 Maintenance and Communication Committee to communicate the new code system. Providers and payers communicate with each other along with CMS, who provides daily updates from the WHO. Changes. As we go about our daily lives, we never think of how much technology impacts it. ICD-9 was vastly outdated, and ICD-10 need to be activated in order to adapt to the technology changes we are facing. These technology changes not only affect everyone as far as their daily lives, but also our billing systems everywhere. There is definitely pressure on IT to communicate with each other, organizations, and other staff members to get their input in order to develop these newer systems. Providers communicate better with each other and their patients with these newer systems. We are now able to log on to patient portals in all our doctors' offices in order to get more communication across the board. We are able to talk to our doctors, nurses, refill scripts, or simply check on our medical records. Technology has definitely come a long way. Payers develop better fraud protection with these newer IT systems, partially from input from the providers that they service. Coders communicate changes through their organization, but also through CMS as well, and definitely each other. It is very important for staff members to communicate changes amongst each other so they can all stay on the same page. Communication. Without it, nothing is really possible. We need to speak to each other, and it is critical in every healthcare organization there is. It is definitely the most critical aspect of coding change. Most of our major communication is done through, as I said, CMS and employers, but staff members too can communicate amongst each other as far as conference calls, emails, phone calls, or even the newest technology called webinars, which is simply computer training with a conference call. Management, however, holds the ultimate responsibility for tracking CMS updates and keeping their staff and managers informed of any coding changes, billing changes, or any other changes that may impact their organization as a whole. Employment opportunities. Coding jobs are steadily increasing, however, and this too calls for communication across the board, from human resources to management to staff who may feel simply overwhelmed and underpaid and need additional help, especially with the new codes coming on board. They are longer, they are more complex, and they do require more time, especially in the beginning until we learn how to work with the new codes that we are being given. Because of this reason, there's less productivity with less staff, which in turn means coding jobs are more available. But again, communication is necessary for human resources to know in advance so they can stay on top of what they're hearing from the management as far as needing more staff to handle the overload. In conclusion, communication, communication, communication. We need it. There's no doubt about it. Without it, any business, healthcare facility, provider, payer, employee, nobody would have a job and everybody would be looking for work. Constant communication and monitoring of any healthcare system is needed. Coding changes needed. Billing changes needed. Staffing needed. IT needed. Everything needs to be communicated regularly and monitored regularly. Seminars and webinars are definitely a good source of communications, and reliable websites such as AHIMA and CMS are a good source of information as well. HR should also be trained as far as knowing who to communicate with as far as staffing jobs and talking to staff themselves to see where the need really is, and taking that information to management to see if it's needed at that time. If not, HR will have that information for down the road. But across the board, communication is key for everything. That's all, folks. Thank you.